Hey there, Dr. Brian McKay, Core Health in Darien. This is my podcast, Not Just a Chiropractor, for Stanford, Darien, Norwalk, and New Canaan. Well, good morning. It's a beautiful October morning, and today I want to go over the topic is why your knee is continuing to hurt, even if you've done physical therapy and had surgery. Pretty heady, long topic. What I want to tell you is my experience is that most of the muscles are not getting reintegrated after a surgery. Listen, surgery is wonderful. You need it. I'm not going to doubt that. But if you are having reoccurring knee pain after surgery, after you've done the physical therapy, well, you got to think why? Okay, do you have to live with it? I don't think so. So we're going to do a little anatomy review today. Now, if you're sitting down, I want you to reach behind your knee and I want you to go below onto the leg, the lower part of your leg, and I want you to push. And you're going to feel a muscle in there, and that muscle is called your popliteus, like the Pope, popliteus. And it's a small muscle that forms the floor of what's called the popliteal fossa. This is where you get Baker's cysts. But a lot of times I think these Baker's cysts come about because this this muscle is not very big, but very important because it locks the knee in extension. So if you don't get to full extension on the knee because this muscle is in spasm or it's shortened, what you have to understand is that you don't get the full mechanical effect of the locking motion of the leg, which is very strong. There's very little stress when you have your leg extended. So it's a very important thing. But if you can't get your leg to full extension, even just a little bit, it throws it off. I mean, just think about it. If you have less air pressure in the front right tire, it's going to wear the other tires out. So what happens is it has a pretty deleterious effect on the surrounding muscles, but basically the meniscus, which is probably what you're going to get operated on. Now, you have an ACL or PCL, you, and those are repaired, and the popliteus is not reintegrated or worked on properly because I guarantee you, if you go back to your surgeon and ask him about the popliteus, he'll say, yeah, it's a small muscle, don't worry about it. I'm telling you, it's going to dig into that area below the knee, go to the middle, stop pushing around, okay? Go to your right, go out to the side, the lateral aspect, and you're going to feel pain in there. That pain needs to be worked out with a technique called trigenics, where what happens is I'll explain it, hopefully it's not too wordy, but you want to stimulate the frontal lobe because you got to get information to your brain. And believe it or not, you have muscle spindle cells in the belly of this very small muscle that goes directly to your brain. Okay. And it tells the brain where this joint is in motion. Now, so what happens is the first step is you take a deep breath in, and then you're going to extend the leg and bring it down as the muscle spindle cells are being activated. So that's a real nutshell. It's kind of easy to show you than it is to actually do it or to talk about it. So popliteus is a major driver in reoccurring knee pain, especially post-surgically. Okay, and if you want to avoid surgery, having that looked at is a really good thing. Today, I'm only going to touch on the different muscle groups because there are plenty. Now, here's another one people don't think about. It's called the pes anserine. Pes anserine is it's actually a French term. It's for goose foot because that's what it looks like. And it's a confluence of three muscles: the sartorius, the gracilis, and the semitendinosus, and they kind of join up on the inside of your leg. Okay, below the knee. Okay, so we're going below the knee. You have knee pain. We got to check above and below the knee. If you don't understand why, then hit don't like or just don't bother listening to the rest of this. What I'm going to explain. The, the tendons, so you have three tendons inserting onto the tibia, okay? Tibia is the bone below the larger bone in your lower part of your leg. A lot of times you're going to have inflammation there and the bursa gets, inflamed. But what happens here again is you have contracture of the tendons, okay? Because this is basically more of a tendinous as opposed to a muscle belly. And in that case here, you have to stimulate what's called Golgi tendon organs. I don't really want to go into it, but if you just look up Golgi tendon organs, you'll see there's two types of nerves that directly communicate with the brain. Well, there's other ones as well, but these ones, as far as the musculoskeletal system, muscle spindle cells, and Golgi tendon organs. So here, there's a certain motion. Like if you were laying on your back and you put the affected leg into a figure four, the inside of your knee on the lower part of your leg, very close to that spot right there. Press it. See how tender it is. Well, guess what? Maybe that muscle, that confluence of muscles, because again, it's the sartorius, the gracilis, and the semitendinosus tendons that we're talking about here that are where we're talking about. So it can be very, very, very painful. So these need to be examined and treated. So when you go to your surgeon, he says, here, just go to physical therapy. They strengthen the leg, but they're not releasing these Golgi tendon organs and reintegrating them with the brain and the muscle spindle cells as well. So you're not going to get the complete results. I have nothing against physical therapy. I think it's wonderful, uh, very beneficial. But if you're not working these areas and you have chronic reoccurring knee pain, then you have to consider, well, I don't want to say consider what I do here, but you really need to have these things looked at. Now, there's actually another muscle. Let's go to the thigh, upper thigh, or above the knee. The rectus femoris is a huge muscle. It goes down right down the top of your leg. So that muscle is definitely involved quite often, okay? It'll contract, and so the muscle's shortened. What we have to do is we have to lengthen the muscle, okay? And if it's weak, you have to strengthen it. That muscle pretty much will get strengthened with physical therapy. But if it's shortened, it's probably not going to. And the way to work that, the rectus femoris, would be to stand up, support yourself with one hand, and pull really tight. It's like something you see a football player do, stand on the sidelines. They grab the back of their foot standing and then pull as hard as you can, and then try to fight against the pull with moving the leg, and that will help lengthen the rectus femoris. Now you have what's also called the vastus medialis and lateralis. So vastus, I mean, think of the term vast, it's large. So these are the muscles that go down the outside and the inside of your leg. And they're part of the thigh muscles, okay? And what happens with these will contract very much so. They also help to extend the knee joint, okay? So extension, as I mentioned earlier, but the popliteus is something to consider here. So not only do you have those muscles, then we got to pull in another one, the obturator. The obturator muscle is really up in the pelvis, and this would be the muscle that you would use to bring if your legs are apart, you say you're sitting, and you're going to pull your knees together. So you spread it out and pull together. That has to be checked out as well because you got to make sure there's no tension. And actually, another side point where the obturator externus muscle is also the insertion point of the rectus femoris. So what I'm trying to get at here is you have a number of different muscles that need to be evaluated if you're having reoccurring knee pain after surgery, even if you've had a knee replacement. Because knee replacement, you got to work the muscles. It's still attached. And if they're not working properly, the brain is getting what's called aberrant signals. So you're not getting the good information to the brain. So I hope I didn't bore you too much, but hopefully I educate you because knee pain, listen, we're all getting older. I'm 60 years old. Knee pain is not fun. And the first thing you think is, well, I'm going to wait and get the knee surgery. Yeah, and that's quite typically an option. I mean, if you can avoid knee surgery, that's even better. And I think what I'm describing is having these muscles worked and looked at and paid attention to, you're going to benefit. You're going to be able to go up and down stairs. You're going to be able to play more sports. I see it all the time. But I have to work those muscles. They have to be evaluated. And not all those muscles are going to be involved when you have knee pain. So you have to make sure that the therapist you're going is trained to see those muscles and know how to rehabilitate those muscles specifically. I mean, it's pretty easy to say, okay, go do leg extension, do leg flexion, adductors for the legs, and you're on your way, hit the bike for 20 minutes. That's all good. I mean, that's getting blood flow, stimulating those muscles. But if the muscles are one weak or shortened, that will create a problem. So I hope I haven't bored you too much. I hope I haven't scared you too much, but this can be treated. This is Dr. Brian McKay, my podcast, Not Just a Chiropractor, Stanford, Darien, Norwalk, New Canaan. Those are the areas I serve. Could have come up with a better name, but I'm stuck with it now. If you got any questions, you can reach out 203 656 3636. 203 656 3636. Hey, have a great day. Talk to you soon. Bye.